Yesterday, one stroke patient got admitted in the late evening within the golden period of time. Hello, good morning. I am Subhomoy Mitra and I'm very glad to be here along with one of the renowned neurologists today with me, Dr. Tanmoy Pal. And Dr. Tanmoy Pal, thank you very much for sharing your valuable time. So, sir, I'd like to ask one question. What I mentioned that the patient each yesterday in the golden period of time and patient admitted under you. How is the patient and why golden period is so important?
It's a very important question as far as the ischemic stroke is concerned. So the golden period is that important part of time by which if the patient arrives in a stroke ready hospital, we can treat the patient very fast and remove the clot from the brain. And why it is important? If the patient reaches within 4.5 hours, so 4.5 hours is the golden period for intravenous thrombolysis, by which we inject a clot busting injection and remove the clot from the brain. So in that way we can prevent the paralysis to happen. We can prevent the consequence of the stroke to happen.
So it's also related to the length of stay can reduce for the patient.
Yes. So very importantly, because stroke is one of the most deadly diseases in our country. So if you search in the internet, it is the second or third most common cause of death. And apart from death, what we are afraid of is the long-term disability caused by paralysis.
There is a warning sign. This is known as FAST.
FAST.
Can you just break down that?
So earlier it was FAST, but now it is BFAST, BEFAST. So it is a mnemonic. It is important to know for the society. BFAST means B for balance. If there is a sudden loss of balance. E for eyes means blindness. If there is a sudden blindness. F means face, means if there is a facial deviation of face. A for arm, if there is a sudden weakness in your arm or in your leg. S means speech, if there is a sudden slurring of your speech. So these BFAST is a mnemonic to indicate the onset of stroke. So it is important for the society to know what are the first sign of stroke. Because if they know the first sign of stroke, then only they can bring their near and dear one
within the golden period of time. So I have a third question to you because what I have found that once you discharge or shifted patient from ICU to ward, the nursing orientation of particularly for neurological patient, its distance as compared to the general or surgical ward.
So for the neurology patients, this is the neuro ward of our hospital. Especially in this ward, we treat the neuro patients of my subject neurology, or the neurosurgical patients are being treated here. So after a stroke patient comes, if the patient comes within the golden period, if we do the thrombolysis or the clot busting injection, the patient goes to ICU. Then from the ICU, the patient comes to this neuro ward. Why this neuro ward is important? Because to take care of the neurology patients, the nursing care is very important. I would say more than the role of doctor, the role of nurses and the role of physiotherapists are very important for taking care of the neuro patients.
So the ratio of nursing vis-a-vis patient is...
In this neuro ward, we concentrate on the ratio of nursing versus patients. So one nurse take care of 2 patients, so that is the 2:1 nursing ratio is maintained in this neuro ward, and the neuro ward nurses are being trained on a regular basis to how to take care of the neurology patients, because they have paralysis. Many of them are not oriented to the time, place and person, so they need a specific training program.
And what about the rehab? Can you show
so next step after the role of doctor, the role of nurses, and then the role of rehabilitation. Rehabilitation does not contain only physiotherapy. Yes, physiotherapy is the most important part of rehab.
Correct.
But apart from physiotherapy, there is a role of swallow therapy, speech therapy, and occupational therapy. Because once the paralysis happens, suppose one limb is not working, so then I have to make the limb functionalize. So for that, rehab is important. So this is our neuro rehab set. Dr. Thinley, who is our physiotherapy head of the department, so he takes care of the rehab team,
This is all sort of
And-
patient with not only the stroke patient.
Not only about the stroke patients, specifically neurology patients, most of them have lost their balance, most of them has lost their limbs. So rehab takes a very important part in the whole treatment.
And sir, what about the healing garden?
Healing garden, yeah. So this is our healing garden. So as I said, that rehab is very important. So for the cognitive rehab, we have this neuro healing garden.
Okay, very nice.
So this is a very beautiful part of my hospital. I am very glad to have this healing garden. Many hospital, I have worked in so many hospital in the country. I have not seen such a beautiful healing garden anywhere. So you can see such a beautiful view, and a patient. It is very important for the.
Can I give another name of this area?
Yeah, sure.
It's a therapeutic garden.
Therapeutic garden, definitely. It's for your cognitive therapeutic aspect.
Correct.
If a patient have depression, post-stroke depression is very common.
Correct.
So this healing garden takes a very important role in that aspect, and also for the cognitive rehabilitation.
Thank you very much, Dr. Tanmoy Pal, for this nice talk. And I'll be coming again with Dr. Pal in different topic. And thank you, viewers, for giving your valuable time. Thank you once again.
Thank you.
Namaskar.